Welcome back, welcome back. This is Good Morning Kenya. If you've just joined us, the best breakfast show in the country and in Eastern Africa. This is a show that comes to you each and every morning from 6 a.m. to 9 a.m. That was an interview, a very interesting interview by the one and only Jane Wambui, interviewing an artist because it is Entertainment Thursday. But we are now shifting gears into matters, the Big Four agenda. And we shall be picking one of the agenda, universal health coverage. Remember, universal health coverage means that it's ensuring that all Kenyans have access to preventive, promotive, curative, rehabilitative, and palliative health services at minimal financial burden. Now remember, today, the president, that is Uhuru Kenyatta, will be launching universal health coverage program in Kisumu. We shall be covering that program right here on KBC Channel 1. So you do not want to miss that coverage because it is one of a kind. Since it is the first time that the president is going to Kisumu after the handshake. And remember, there are 2 counties that have already done this. And in fact, that is the these are the counties that are joining us today in studio. Remember, ladies and gentlemen, I'm joined by Dr. Richard Mudhoka from Kitui County. He is the Chief Officer in charge of health services. And to my farthest left is Patrick Musyoki, Makueni County Chief Officer in charge of health services. These 2 counties, Makueni County was #1 when it came to implementing the universal health coverage, and Kitui County was #2. By the way, big congratulations to that.
Thank you very much.
And thank you very much for coming.
Thank you.
Remember, our hashtag is Good Morning Kenya on Twitter, at KBC Television, at Ram Aguko. Now, you are the first to implement this, and you are the second. I would like to find out from the both of you, should we have counties taking notes from each other? And in fact, other counties taking a note from you? If I would start with you, Doctor.
Thank you very much. I think counties actually are like families. Mm-hmm. We are neighbors. We are all destined by the Constitution of Kenya to do the same service for the citizens of this country. So for us really, especially Makueni, Machakos, Kitui, the neighboring counties, we have really wanted and have been at it working with each other, making sure that we learn from each other. Mm-hmm. Working very closely with my brother from Kitui, our governors through the SECEB, which is an economic bloc, and even matters health. So like for the universal healthcare, really, when Makueni started in 2016, Her Excellency, Madam Charity Ngilu, when she became governor, she got interested in this plan and sent her entire team to Makueni to just come and see how does this thing work. And we want to congratulate them because immediately they came and we went through them what we were doing. They went back and put their own thing that really is serving the people of Kitui very well. Mm-hmm. And we thank God for that commitment.
Mm-hmm. A very big congratulations to you, Makueni County. Of course, with the leadership of Governor Kibwana. How does it feel as Kitui County? And did you notice that someone is doing something? We need to pull up our socks.
Yeah, I think when the governor came into office, one of the things that she had in mind was that she was very clear what she wanted. Mm-hmm. She had promised the people of Kitui that she was going to implement universal health cover.
That is Governor Ngilu.
Governor Ngilu.
Yes.
Yeah, and from the start, she wanted to make sure that this does not delay, because any delay was to continue affecting our people. And so she put up resources together, and because of the good relationship that we've had with the people of Makueni, we didn't want to reinvent the wheel on many things that we were already doing, and from the lessons that they had learned when they were starting. And so we went there and we had a good reception. We went through and we were able to know what are the things that they had put in place before launching the universal health cover, and also the challenges that they had gone through. And we were able to improve on that to make sure that we avail universal health cover to our people within the shortest time possible. That was way back. The benchmark was done on September 2017, and on 21st of August this year we were able to launch universal health cover.
Now, let me go to Makueni County. What challenges have you had so far? You have had this thing starting, and it has been more than a year now, I believe so. And there is a time that even Dr. Kivuta Kibwana had said that the number of households that have enrolled for the county universal health program have nearly tripled. There is time he said that. What challenges have you faced so far?
I think the main challenge really for our people, because the poverty levels are quite high. In 2013, when at the onset of devolution, this stood at around 64% in Makueni. Currently, it has gone down to around 60% of the 60% poverty index. So really, there are still certain families that are not able to afford the 500 shillings that a household is asked to pay to get the cover for 1 year. So that has been one challenge. But so far, around 60% of the households in Makueni are registered into the program. The other challenge really is about healthcare workers, because it is not just offering any health service that constitutes universal healthcare. It has to be quality health service. And so before devolution, the number of healthcare workers who were employed by government, national government then, were very few if you compare that to the national norms and standards for staffing. So having to bring on board more healthcare workers, of course there is a financial cost, and because the money that counties are receiving, being just 15% of the national cake, is very little money. So there is a balance between recurrent expenditure in having to employ more healthcare workers so that they offer that quality service towards UHC, and also balancing that with the development for the county.
All right.
But so far we thank God, because in 2013 we only had around 977 healthcare workers in Makueni. Currently we've doubled that number to around 1,700.
Now, within Makueni, the same county, last year, there is a lady who had a problem when it came to acquiring health services, especially when it came to her getting insulin. How do you cater for such people or accommodate such kind of people within the scheme of the universal health coverage?
In fact, our UHC is very well guided. The county has a guideline, and the services that one benefits from when they member themselves to the Makueni care are very clear. And insulin is actually part of the spectrum of care that we offer, part of the package that we offer. So as long as a household has that card, they are able to access insulin in our hospitals, the 10 hospitals, free of charge. Drugs they are able to access, inpatient services they are able to access, theater services they are able to access. And in the unlikely event that a loved one loses their life, the first 10 days of mortuary is also catered. So it is a very robust and generous health package that we offer as a county, with a few exemptions, because again, universal health care does not mean that each and every service is free of charge. So like implants, surgical implants, those ones somebody has to pay for them. But the theater service, the inpatient services, everything else, the radiology services are free of charge. Dialysis, that one is exempt. ICU services is exempt. But majorly, 90 to 95% of the services within our public health institutions in Makueni, the services are offered at no cost.
At no cost. What is the reception for Kitui County so far since you launched this program?
From the time we launched the universal health cover, in Kitui we call it KCHIC, Kitui County Health Insurance Cover.
Oh, you call it KCHIC?
KCHIC.
For your county you call it?
Makueni care.
Makueni care. Oh, okay.
Yeah, so far we've had close to 100,000 households that have been registered into the cover. And the number is growing because people have realized that the packages that we are offering, they are quite comprehensive. Just like Makueni, except just a few a few services that cannot be provided within the facilities that we have that require referrals and other things like surgical implants. All the other services are offered for free.
But the ones that are not offered for free, how do you cater for such people? Because they may be demand.
Yeah, they are there, but you notice also the cost of such surgical implants are quite expensive.
Right.
They cannot be covered under the fund. So we also expect the families to be able to take up some of those costs, like some surgical plates, orthopedic surgical plates, which are quite expensive. The patients will have to cater for the cost.
But how can a patient cater for the cost of that? If, for example, is someone who is old?
There are a few exemptions that have to be approved by a waiver committee. But by and large, what we expect is that most of the packages that we are offering are free. But if you find is maybe a procedure that will need, maybe cannot be done within the Kitui environment or Kitui hospitals, then that has to be catered for by the family.
Right.
It is something that we are trying to address, but given the scope and the amount of money that the KCHIC and families are contributing, those costs are something that we need to engage and make sure that we set money to make sure that they are covered. Currently, even when you look at our KCHIC regulations, they are exempt. And something that we are working to make sure that they are included at the end of the day. So
people within your county are receiving this program well? Is the turn-up as expected?
It's overwhelming. It's overwhelming because when we started, we never thought that within less than 3 months we'll have over 100,000 households registered into the program.
And how many households do you have in the country?
On average, we have about 240,000 households.
240,000?
240,000
And the number of households that have registered so far are?
Close to 100,000.
100,000?
So almost 50%.
Almost 50%?
Yeah.
What about the rest? How do you tend to?
We still continue to encourage the families to take up the bold step and register, because obviously we know what it entails. If you look at the statistics, 6.2% of our population, they fall back into abject poverty because of catastrophic costs that are associated with ill health.
Okay.
So to cushion them from that, we are encouraging members of the public to take that decision, sell two chicken, which is equivalent to 1,000 shillings, and they register to the program. Just like Makueni has said, if you look at the package that we have, all the costs are actually offered for free. All the costs that are available within our facilities, they are offered for free. Treatment, that's diagnosis, radiology costs, renal dialysis costs, all those, including actually in an event that a member of the family succumbs and dies, we are offering 7 days free mortuary services to the families.
Now, since we got challenges from Makueni, I would like to get to know challenges from Kitui County.
The main challenge, I'll say, it's sensitizing the people to understand that health is a priority. Many people don't seem to understand until the day they fall sick, and they come and you ask them, do you have KCHIC cover? They tell you no. And remember, 85% of our population don't have NHIF.
Then how do you intend to sensitize them?
We've put resources in place and also encouraging members of public who have benefited from the program to say, to tell the community what actually benefits they have received from this cover.
Now, you've talked about payment of 1,000 shillings, eh?
Yeah.
And for your county, you've talked about payment of how much?
500 shillings.
500. I would like to know why the difference in the amount of payment, but I would like also to know this payment, is it per person or per household? How is it?
The 500 shillings that Makueni charges is per household.
Per household.
And that household, we have not restricted the number of, for example, children, like the other private covers, they will tell you up to a maximum maybe of 4 children. For us, the household is the principal member, the spouse, and all children who are 18 years and below. Whether they are 10, whether they are 15, we cover them. And any child or dependent who is 24 years and below, if they are school going, if maybe they are disabled, those ones are covered. So the 500 shillings is actually per household.
Now, regardless of the number of people you have in your household.
Correct.
Even if I have 18 or even if I have 3. 18
years and below.
Oh, 18 years and below. Okay.
They're covered.
And as for you?
For Kitui, we are using 1,000 shillings per household. And it's for any child who is below 18 years. On average, a household will have about 5 members of the family. But also, we make sure that those children, those who are more than 18 to 24 years, as long as you can show proof that they are in school, they are also included in the package.
Even if I have adopted children, they are considered to be part of my household?
They are considered to be part of the household.
Yes. But you cannot assume that my household may have average of 5 people?
That's an assumption, but it's not actually cast in stone.
Okay.
Yes.
But why is your price 500 and yours 1,000 shillings? What is the reason for that variation in payment?
If you look at the costing that we did, one was advised by the geographical size of the county. Kitui is 6th in geographical size in the country.
Yes, yes.
Covering over 30,596 square kilometers, which is about almost 4 times the size of Makueni. And secondly, also, we know for sure, we looked at the amount of money that we had collected previous year, which was about 131 million shillings. And basing on these 2 facts, we were able to determine and say if we charge this amount of money, then we'll be able to provide the kind of services, the range of services that we intended to offer to our people. We are yet to do an actuarial study to show exactly how much money is needed, same to Makueni, to offer complete package of these services. But that could not make us to wait until we do that. So we decided the best way to learn is actually to put things into practice, and that's what the bold step that the governor took and ensured that we get started, because it was something that needed to be done.
Okay.
We have learned a lot of lessons. We are learning a lot of lessons from the different things that we are encountering as we implement the UHC. And this is going to give us a lot of knowledge when we are improving from day to day operations.
All right.
Yeah.
Now, there is something that I would like to also understand now, putting both of you now within this conversation. Does it relate also with distance? For example, in Kitui County, someone who is in labor and has to come all the way from Tiva and is going all the way to Kitui General Hospital. Yeah. What criteria do we have to cater for such people?
I think for us, and I think WHO is really advising that for you to have universal healthcare, you must give a lot of focus to primary healthcare. And primary healthcare actually is the cornerstone towards universal healthcare.
Primary healthcare is the cornerstone to universal
healthcare.
Wow,
so really, if as counties, as a national government, as a country, we want to get this thing right, we must start at the primary healthcare level.
And how can you do that?
This is where you have the communities being empowered to be in charge of their own health through community health strategy. You have the level 2, the dispensaries, the health centers. You must be able to have functional dispensaries and health centers so that what you're asking, like a pregnant mother who is in Tiva, maybe, or somewhere very remote, Athika Monyuni in Makueni, they don't have to travel long distances. They don't have to travel to the sub-county hospitals for them to get assistance, either normal delivery or cesarean section.
Oh, they don't have to travel?
They can first visit the very close dispensary, which in my county, we have been able to put facilities. We have been able to build staff houses for the workers so that they are close by. You have the facility well equipped. You have the facility with the adequate and requisite drugs.
But the question is, are they there? Because you may...
Yes, they are there. And that is why, before we started universal healthcare in 2016, we had to strengthen all the 6 building blocks advised by WHO, because universal healthcare is a journey. It is not a big bang theory. Certain things must be in place before you now say, we are going to remove the cost that people pay at the sub-county hospitals.
Okay.
So over time, we have been able, like in 2013, we only had 109 health facilities in Makueni. Right now, we have doubled that number to 235. So the distance that one had to walk from 9 kilometers in 2013, now citizens of Makueni only walk 4.5 kilometers to access a health facility. And that is in keeping with universal healthcare. Access must be catered for.
And how would you respond to that?
I totally agree, because one of the things that you realize is that distance is one of the barriers for access to universal health coverage. And so one of the things that we did as a county was that to make sure that, first of all, because of the political goodwill which was there, to increase the budget for health. And you realize also, building on the 6 pillars of health, as recommended by the WHO, we were able to double the amount of money that was committed to procurement of medicines and health technologies, from 250 million to 500 million. We also set up a budget to employ healthcare workers, because you find you could have a lot of buildings, but as long as there's no healthcare worker to offer the services, patients will have to travel long distances.
And you've mentioned something there, because I'm aware that Governor Ngilu had confirmed that the administration for Kitui County will improve staffing of trained personnel who will handle complex health operations when in need. How far have you gone so far in terms of staffing?
The county has made significant progress in that, given that we have already committed to employ. And Kitui County, I believe, is one of the first counties that many healthcare workers across the country have called to ask, how did you do it? And we were able to employ doctors. The first round, we employed 35 doctors and made sure that in all the level 4 hospitals, the 14 of them in the county, all of them were being manned by doctors. We also made sure that we set up a budget to employ nurses, because we realized when the governor came into office, there was a very high attrition rate. A lot of hospitals that were running had actually been closed, literally closed. And so the first thing was to make sure that we open up all those hospitals. There was about 180 operational dispensaries.
Okay.
Today, as we speak, we have 215 dispensaries, 56 health centers, and 14 level 4 hospitals. So we want to make sure that we reduce the distance that our patients have to cover to access healthcare. Now,
there's something that I would like us to get into. Now that someone you've reduced the distance, now that I'm in the hospital, I've been admitted. Now, let's talk about the inpatient facilities that we are having right now. Someone has taken longer in hospital, more than 7 months. Do we have facilitation for such people? Do they have to pay extra for food and for treatment, beddings, things like that, medication? How do you cater for such people?
No, as long as a patient has paid for the universal health cover, we are not determining how long this patient should stay. But on average, what we've noticed that patients are staying for about 5 days inpatient. But in an event that a patient stays for long, because of maybe the nature of the sickness, we are using the same cover to cover for all the costs that are associated with this patient staying in the hospital.
They are covered?
They are covered.
I think He's actually saying that it really does not matter if you are in a hospital and you really need to be in that hospital. The government will not come and tell you that you have exhausted your cover, so now you have to cough up and again go back to the catastrophic health expenditure. But on average, we know that the average length of stay for a patient in a hospital determines and actually is an indicator on the quality of healthcare that is being offered.
Okay.
So on average, at least three to 4 days is the time that a patient should come. They are diagnosed in time and accurately, and they are put on the right medication. On the third, fourth day, they should be on their way home.
And you mentioned the word should.
Yes, they should.
And
Because
in the case that they cannot?
I'm saying most of the cases.
Okay.
If you're offering the quality healthcare that you need to offer, immediately a patient steps into the hospital, they are well diagnosed. Sometimes a patient will overstay in the hospital because the wrong diagnosis was made when they arrived. But if now the quality of the UHC you're offering is the right quality, it means this person comes, the requisite investigations are done in time. They are not told the full hemogram machine is not working, the lab person is not there, you know.
Now, there's you've mentioned someone taking longer for wrong medications. Do you have the same facilitation in terms of outpatient? Does it cover both inpatient and outpatient services?
Definitely. Outpatient services are covered, inpatient services are covered.
Now,
I think just to add on what he said, one of the things that we discovered is that people used to come to the hospital when it's very late. Because one, they didn't have money to ensure that they are treated and given the right cost, right treatment. And when we opened up through universal health cover, patients are able to go to the hospital when the disease has not progressed significantly. So we are also advocating and ensuring that we sensitize our people to make sure that they go to seek health services when it's still early and at the lowest level of care, dispensary, at the health center, they are able to be given the treatment that they need. And in an event that the disease progresses now, they will be able to go to the level 4. But if you wait until a patient is bedridden and is being brought to the hospital, then that's why you are realizing that most of the patients, they are taking longer. But we are noticing as we open up the doors to the patients and they realize that they are able to come and seek health care without incurring any additional costs, then they are actually, most of them are coming. Like, for example, we just started the other day, universal health cover. Kitui County Referral Hospital, we used to see about 400 patients per day. Currently, on an average, we are seeing about 900 patients.
And all of them are being catered for?
And these patients used to stay at home because they didn't know what to do. And now, because they know that they are able to access healthcare, they are coming out. We are also encouraging them to go to the lowest levels of care because in those facilities, like in the health centers, the dispensaries, we have sufficient stocks of medical and health technologies within those facilities. We have lab technologists who have been employed and posted to those health centers to offer diagnosis services. And so as you decentralize services, we know for sure many of the patients will see and will be able to go to the hospital to get treatment at the earliest opportunity.
Now that the numbers have increased, we will not. How do you tend to cater for cases whereby the beds are sufficient enough for all patients who come to the hospital? I see you're smiling there.
Of course I'm smiling because this whole thing of universal healthcare has to be holistic. And we talked about the WHO building blocks. As you roll out UHC, there are certain things that you must continuously improve on. And Kenya, being a country where we are very innovative, we added two blocks to the WHO. We added infrastructure and we added research. So for the infrastructure part, it is envisaged that when you remove the financial barrier, the numbers will go up. So from the word go, you must be prepared in terms of expanding the inpatient facilities, in terms of expanding the theater services, in terms of even expanding the laboratory services, so that when these patients come, you are able to actually accommodate them. They don't have to spend 2 of them in one bed, you know. So essentially, really, you must be prepared to have the numbers rising.
And are you prepared?
For Makueni,
yes.
I told you we started in 2013 with a lot of infrastructural expansion, and we continue to do that. We only had 3 hospitals which had operating theaters in 2013. Right now, the county is able to mobilize 14 operating theaters at any time.
Now,
manned by medical officers, the nursing care, so that if it's, for example, the wards where patients are coming, all our 10 sub-county hospitals, we have been able to build wards so that any patient who comes, they have a decent bed, they have somewhere where they can actually, as they recover, there's decency in the service that they are getting.
And even decency in terms of treatment in the hospitals.
Correct.
And
Correct.
No patient is mistreated when they are there, right? For example, in cases like ICU, things like that, yeah, they are catered for.
They are catered for. Makueni didn't have an ICU. Now at least we have one small one, 4-bed ICU, operational. Actually, it's manned by one of the Cuban doctors who we received from the national government, and we are doing great.
All right. Now, let me mention something here. We are living in a developing world. Technology is developing, and we move with the developments. Yeah. Are we enforcing technological developments even through this universal health coverage in terms of ensuring that everything is computerized? How far are we in terms of ensuring that even if I go to one hospital, I can go to another hospital within my county and still be treated because every doctor has my medical records?
I think that's a very good input. When we started the universal health cover, one of the things that we thought about was you will forget your card at home.
Yes.
Or maybe you've had an accident and we are not able to get your card. One of the things that we did as Kitui County was to make sure that we issue biometric cards. So either when you produce your ID number, at the hospital level, they are able to check and see your details.
Okay.
This is something that we plan to enhance and make sure that we have an integrated health management information system, which is going to be installed in all the 14 level 4 hospitals. Currently, we are in the process, and because this is something that has to be done gradually, we are hoping that is going to work very well, because with the biometric identification, you are able to pull patients' medical history. You are able to know this patient is registered and the cover and where they come from. Because when you are registering, one of the information is that you are able to tell us where you come from.
They don't have to carry the cards for the hospital?
With time, now we are requiring them to carry, but we are actually making sure that we decentralize that service, and we are able to pull patients' information using the biometric registration.
Are you doing something in terms of this?
Definitely, technology really increases efficiency and even cuts a lot of cost in terms of the services that you offer. So our 10 hospitals, all of them have a health management information system that deals with logistics for commodities, financial management, and we are also using Google Drive to integrate these hospitals, so that at least if I register in Makindu Hospital and tomorrow I go to Mboni Hospital, they are able to see my details from that at the end.
Interesting.
Yes.
Now, I would like to engage with you on our social media platform. Remember, the hashtag is Good Morning Kenya on Twitter, at KBC Television, and at Ram Aguko. Let me read just but one tweet here. This is at ENG Mrefu. He's saying at KBC Channel 1, this is one of the finest morning conversations. Thank you very much. He's saying this is one of the finest morning conversations. The masterminds of UHC. I appreciate Dr. Musyoki, COM Makueni, and his counterpart from Kitui. I am a beneficiary of Makueni UHC services, real estate of devolution, specifically in the health sector. Hashtag Good Morning Kenya. You see, we have a beneficiary there. And I would like to just ask one question here, because time is not on our side. I'm seeing it's 8:57. Do we have a budget when it comes to catering for this universal health coverage? Is the money that comes to the county sufficient for you to ensure this thing goes at 100%?
I will say the money is one of the biggest challenges and factors that we have to think about. Do we have a budget? Yes and no.
Yes,
because with the limited resources that we have, we are able to plan to make sure that we offer the basic services to our patients. We know for sure that we require more money because health, one of the biggest costs that we have to encounter in health is the health technologies and products. We need a CT scan, like Kitui just bought one CT scan machine, and you realize that because there was no money which had initially been set for that. You have to get money for other programs to make sure that you assist your people to make sure they don't have to travel every time. A person has to do a CT scan, has to travel all the way to Nairobi, to Machakos to get such services. And also we had to make sure that we procure other things like X-ray machines for all the 14 level 4 hospitals. We have to equip our labs. In total, we need about almost R1 billion to be able to buy what is needed at all our facilities. That budget is not there, but what do we do as a county? Because there's political goodwill, the governor has given a directive that health is her #1 agenda. If you look at the 5-pillar manifesto, that
even based on her history in the ministry.
Exactly, because as I was saying to you earlier, unless you have a political goodwill, it is not possible to succeed in universal health cover. And we want to thank the president because he's taken that bold step to make sure that he introduces universal health care to all the people. Wow. I think if I was to be asked any legacy that the president is going to leave, I would say universal health cover is going to be one of the biggest legacies that the president will leave in this country.
And today we are launching the universal health care at Kisumu, and the president will be launching it. I don't know, what is your expectation concerning this launch, especially coming from Kisumu County?
I think we want to congratulate the president and really the entire Ministry of Health National for that very bold step that they are taking. It's a pilot, yes, 4 counties, but I'm sure the lessons that the national government is going to learn from this pilot, they're going to use that to expand to the rest of the country. But I think really, because health is fully devolved to the counties, that partnership between national government and the counties is very important, so that we make sure that everybody feels they're playing their part, they're recognized, they have their space, and together counties are going to be supporting the Big 4 agenda that the president has set forth.
Now, what initiatives should we have from the public? Because I'm thinking the initiative has come from the government side, both the county and the national, but the public needs to participate. The public side also needs to do something. What initiative or things should the public go for us to have this universal health coverage going at 100%, even to the point that even our children are aware of it and it is sensitized even in the schools?
I think the public, maybe, they also have to be responsible, because the national government, the model they are using, they are issuing NHIF cards to every household in those pilot counties. So if you have that card, one can be very prone to want to abuse it, in terms of maybe you are not unwell, you just want to go and use it, you know, just abuse. And sometimes there's always that temptation.
They just feel like going to the hospital.
They just go collect drugs and just go and put them at home. We have seen that happen, especially coming from a point of view where one was not able to access these health services. They think that after a week, if they go back, drugs will not be available. So let me go and pick them and keep them in my house. So really,
quite interesting there.
And we saw that even in Makueni when we started,
Yeah.
because previously hospitals didn't have drugs, and before devolution, you know, so people thought the county has brought drugs, but if we are not careful, maybe they will not bring again. So that confidence has been building to the extent that now they know it doesn't really matter. Anytime I'm sick and I go to hospital, I'm able to get the drugs that I need. I don't have to hoard them.
Now, there's a very important thing that I would like to find out. Must I be from your county to access the facilities of UHC?
Definitely no.
No.
As long as you reside in these counties and you have paid for UHC cover, you don't need to be necessarily from that particular county. You could be working in that county. You could be doing business in that county. You could be having your family stay in that
What
county.
if I've transferred from Nairobi? I've come to this county, Kitui or Makueni.
You could be having, maybe, if you come as a patient, you'll be treated. So the models of payment is what actually differentiates the kind of service. If you have UHC cover for the county, you'll be treated. If you have NHIF or insurance cover from the insurance companies, you'll be treated. You could also opt to pay for the services using cash. So you don't necessarily have to be from these counties so that you can access healthcare services.
No, I'm not talking about healthcare services. I'm talking about the universal health coverage.
The catchword is you have to be resident in the county. For our model, you have to be resident at least for the last 6 months. It doesn't mean that you are Kamba. It doesn't mean that you were born in that county. As long as you have been resident and you're able to demonstrate that for the last 6 months, my name is Ambuotho, but I've been living in Makueni for the last 6 months.
Okay.
You are entitled to be registered with Makueni.
And just so we are clear, if, for example, I have been transferred to Makueni County, I have never been a resident there, and I would like to get the services from there. I registered from a different county. Must I be there for all those 6 months for me to be able to get these services?
The mode of payment will change. You will not be able to access the Makueni care if you've not been resident for the last 6 months.
That brings complications.
It doesn't, because you also want to check against influx, because everybody can just come and say, now I'll be living in Makueni for the next 1 year. After they access treatment, they are gone.
They're gone.
Yeah, so it is actually a safety net to make sure that only the people who are resident are able to access this service.
For Kitui, when we were developing the regulations, UHC regulations, the public was very much involved. And we realized such challenges are likely to arise. And so we agreed, as long as you are a paid up member of the UHC, you are able to access these services. Yeah.
And I would like to know about the mortuary aspect. I believe you had mentioned just a little bit of 7 days. You mentioned 1 week.
Yes, yes.
1 week.
Yeah.
Now, what about an extension of past that 1 week?
An extension of past 1 week, because, when you are developing regulations, most of the information comes from the public. We've noticed that traditionally, a lot of people, they stay in the mortuary for not more than 7 days. And in an event that you have to stay for more than 7 days, you will be charged based on the amount of money that is charged in the mortuary, which is about 500 shillings per day.
So that is now a personal expense?
Yes.
It becomes personal. For us, after 10 days, the first 10 days free. After 10 days, now you are billed.
Okay. After 10 days for Makueni, after 7 days for...
After 7 days for Kitui.
For Kitui.
Which came from the public.
Oh.
We did a public participation.
All right.
The public said they were comfortable with the 7 days. Yeah.
Now, as we wrap things up, I would like to know, how far do you think this is in the next couple of years, the universal health coverage? Is it sustainable?
Universal health care is sustainable. One, if we notice that if you don't have a healthy population, then all these other big things we talk about, they become hot air. So our priority as a country must be able to have a healthy population so that they are able to meaningfully engage themselves in socioeconomic activities. And the minute we realize that, then it means we must avail resources for the same. And I think all governments across the country now are taking UHC very seriously. WHO is giving a rallying call towards UHC, and it is part of actually the Sustainable Development Goals. So it is something that really, it is not an option for countries. It is something that they need to give to their citizens, because health now is a human rights issue.
All right. Thank you very much for coming. There is a lot that we can discuss about, and I would like to appreciate you. Kitui, yeah?
Yes.
And Makueni Care. In studio, ladies and gentlemen, that is Dr. Richard Muthoka from Kitui County, Chief Officer in charge of Health, and Dr. Patrick Musyoki, Makueni County, Chief Officer in charge of Health Services. Kitui and Makueni Care. It's all about the universal health coverage, ladies and gentlemen. Remember, statistics say that the numbers have improved based on these kinds of services that we are getting from the universal health care. So we would like to encourage each and every one of you to ensure that you enroll in this. Payment is per month, right?
Per year.
Per year.
Per year.
Per year.
Annual subscription is 1,000 shillings for Kitui. And
500.
500.
Makueni.
Interesting. Our hashtag is Good Morning Kenya on Twitter at KBC Television and at Ram Agugo. Keep it locked right here, because we have the coverage from Kisumu County live about the pilot program for Kisumu County Universal Health Coverage. My name is Ram Agugo. See you on Monday as we have another segment of Good Morning Kenya. And I remember also, it is also going to be my colleague's birthday, Jane Wambui. Remember to follow her on Twitter at Jane Wambui, and wish her a happy birthday. God bless you. Have a good day. Keep well. Keep healthy.